Dear colleagues, I would like to present to you today a short lecture on timing and sequencing of a treatment plan involving implants. Now, planning for treatment involving implants can be a simple task or can be a complex task, dependent on various case factors we're dealing with. But one thing is always certain: it must be comprehensive and structured. Now, planning for treatment involving implants always begins with a detailed patient assessment because it usually involves almost every discipline of implant dentistry. And that is influencing the timing as well as sequencing of the implant treatment. Sequencing of treatment plans is more or less like sequencing every good business plan. It starts with an idea, it goes through planning and strategizing, and eventually leads to success of the business endeavor. These are the treatment steps which are common to most treatment plans involving endosseous implants. We have pre-implant phase, we have prosthodontic planning, then timing and planning of our surgical steps, leading to loading protocols, delivery of provisional prosthesis, and then design and delivery of definitive prosthesis. The last one is often the most important one, which is continuing care through regular recalls. Age-related factors and systemic conditions are also a very important part of an anamnesis because they can alter the timing and sequencing of implant treatment. Age is not a contraindication per se, but can influence the timing of implant placement, especially in patients who are younger and they haven't completed their skeletal growth. Implants, if placed in immature patients, can often become infraoccluded because they do not erupt during dental alveolar development.